Well, welcome everyone to NAMI at noon. I'm Amy Brundle. I'm the Marketing and Communications Manager for NAMI North Carolina. And as always, we're pleased to have everyone here for today's webinar. Also, as always, we'd love to thank the Department of Health and Human Services, especially the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services for their support of today's webinar. A couple of housekeeping items. If you've been with us before, you know that we funnel all of our questions for today's speaker through the Q&A section of your screen. So if you just look below, you'll see that Q&A box. You can put all the questions there, and then when we stop and take questions towards the end of the presentation, we will refer to that box for your questions. We'll also be sending out any materials that the speaker provides, as well as a recording of today's session and a feedback survey early next week. And now it's my privilege to introduce Patrick Gilligan from Somethings. After overcoming an eating disorder as a teenager and the death by suicide of a college classmate, Patrick has dedicated his life to teen mental health. He studied product design and computer science at Stanford, with a focus on applications in the mental health industry. Patrick is now the CEO and founder of Somethings, which is a peer support telehealth application geared especially for teens and young adults. Welcome, Patrick. We're really glad to have you.
Thanks, Amy. I'm super excited to be here. Thank you all for also being here and wanting to talk about youth mental health. This is one of the major issues of our times is how many young people are struggling with their mental health. And I think I'm probably preaching to the choir here, but happy to be here, Amy, and happy to help in any way I can.
Yeah, well, I mean, you alluded to, how important your solution is to a growing problem. And so we want to talk about first just kind of finding out how you personally got involved in mental health support and why this is a big deal for you.
Yeah. You did a great job sort of sharing the highlights as well. And like many people involved with NAMI, I am someone with lived experience of mental health. When I was about 13, I started struggling with body image and ended up developing an eating disorder that I struggled with for most of my teen years, into my college years, and just really struggled at the time to be open about what I was going through with my friends, my family. It was really hard to find mental health resources in my community. I grew up in Texas, which there wasn't a lot of conversations about mental health at the time. And it took me into my college years at Stanford, which was a very different culture until I was able to get resources and support. And fortunately for me, and I'm very grateful for this, but I was able to get into some amazing treatment resources that just like totally changed my life in the most profound way. And it was almost like I kind of woke up and was like, oh my gosh, like I didn't realize that I could live in a way that wasn't constantly in a full mental health struggle. I think most people who have gone through a lived experience with something like that feel similarly. It's sort of like your eyes open to a new world. And because of how dramatic the change was for me, I always joke that I became like everyone's annoyingly pro therapy friend, and it always came natural for me to like talk about what I'd gone through, which to this day, I still don't hear a lot of men talking about struggling with eating disorders, and I've never had a difficulty talking about it. And I think, again, the people at NAMI live this ethos, which is like what happened to you doesn't define you, right?
Mm,
And always felt that way. And in sharing my story with others, I've always felt that what I got back was an openness and a ability to connect with people in a way that I hadn't before. And so I just kind of got hooked on like being the informal advocate for all the people in my life and my friends. And as you mentioned at the time, I was still at Stanford. I was working on a master's program, and I had a classmate die by suicide in a dorm room, and it was just a really kind of shocking and eye-opening experience. Which, upon reflection, this was not a one-off thing. We every year that I was in school there, we had probably 2 to 3 suicides, and they were always an email or two that you'd get out from the provost, and then everyone would kind of forget about it and move on as if nothing happened. And I just kind of looked around and I was like, man, all the smart people that I know are working on, you know, AI research or crypto research. And I was like, how is nobody trying to solve this problem?
mm,
So I ended up just kind of going down this rabbit hole of trying to figure out why, despite the fact that the younger generation is the most open and receptive to mental health care and support ever, why we've seen a near doubling of mental health issues across all dimensions, across all demographic profiles, across all gender spectrum. Like, why are youth struggling so much more today than not? And I'll pause there and we can take the conversation in whichever direction would be helpful. But it's just kind of become like a life passion of mine to try to
Mhm.
solve a part of this problem. And the organization that I started, Some Things, our mission is really to end the youth mental health crisis. And the way we define that is by reducing the number of suicides that happen by youth back to 2008 levels of about 6.8 per 100,000 in the US. Right now, it's about 11. So,
Yeah.
got a lot of work to do, but I feel very grateful that I had the opportunity to recover, and I'm hoping to give that to as many other young people as I can.
Yeah, I think you're right. I think the reason why a lot of us get into this field is because it's personal and we want to become the advocate we didn't have when we were going through our own journeys. And so, your work definitely reflects that. Um, Given kind of the fact that you have decided to focus your energy on teen and young adult mental health specifically, um, what are some of the biggest issues that you're seeing young people deal with right now? And I know that's a super broad question, so kind of fill in the gaps however feels natural for you, but
Sure. I think about this a lot, and I get a lot of questions of like, why is this happening? Why do we have so many
Mhm.
kids who are struggling? Why are 40% of kids in the US, why are 44% of kids in North Carolina dealing with consistent sadness or hopelessness or some form of mental health struggle? And I think the best answer that I can give, and this is a complex system, so there's never going to be an answer, but I think the best way that I think about it is being a teenager is always hard. And you've got a set of stressors that I think for all adolescents over anywhere in the course of the last 100 years have been challenging. You've got complex social dynamics that you're trying to navigate amidst a changing biology that makes you very interested in making sure that your position on the social hierarchy is appropriate. You have academic stress and pressure from parents or your community to succeed and be really effective in school in a setting that, for a lot of kids, maybe isn't the perfect setting for them.
Mhm.
You've got family stress, challenges where parents have expectations, or maybe your parent, for a lot of parents that we hear, they're working full time and they're not able to be around as much. There's a set of adolescent stressors that you know, if you go back 50 years, are still the same. They haven't changed. Um, then for kids today, you've got a totally new set of things on top of that, right? You've got instant access to talk to anyone in the world right now. You've got unlimited streams of data coming through of information that much of which can be helpful and informative, I'm very pro technology in how it can help people do things that they could not have done before. But you've also got lots of information and things coming at kids that is not age appropriate for them, is too much, right? Like a little bit of a good thing can be great. A lot of a good thing can be a bad thing,
Mhm.
especially when we talk about entertainment content. Kids are open to the entire world. They see everything. They see all the news. They see everything that's happening, over on different parts of the world, and it's hard. It takes them out of sort of the challenges that they have in just being a teen in their own life. And I think all of those modern day issues just amplify the challenges that the teens normally face. And I think that is where you get a lot of these accelerant of issues. I think the period of adolescence is all about development. It's all about learning. It's all about growing and facing challenges that are age appropriate for you. It's in adolescent development, the formal operation stage starts at about 12, which is really when teens start developing abstract thinking. They start ability to plan and have goals and direct, and that's still developing. And when we actually look at like what the age of which mental health issues present, it's actually about 13. So at the earlier stage of their development is when we're seeing a lot of kids start develop these challenges. And so um, there's sort of like a gap in the skills that I think young people have to be able to navigate some of these more challenging stressors that are novel. And as an example, to make this really concrete, you know, teens forever have always dealt with social stressors, right? Like having friends that are challenging or trying to figure out, who they're going to date or who they like and all that stuff. It's always hard. But I spoke with a teen recently who had an experience with a suicide attempt. And what had happened was she received a screen recording of a group chat where all of her best friends were in that group chat talking bad about her,
Mm.
and she was not in that group chat. And for her, like that was too much to handle, and that caused a suicide attempt because she was like, my friends are they've betrayed me in this way, and she had access to the proof in a digital form that will never go away. And for her, that was too much to handle. And so that is where I think some of these new novel challenges come through of how do you navigate that situation? Like parents, I don't think could help a teen navigate that situation, right? Like, I don't think that there's lots of new opportunities for those stressors to be pushed on. So when I
Mhm.
think about sort of like why is all this happening, those are really the two buckets. Um, so maybe I'll pause there and we can go further if interesting.
Yeah, I mean, I think that that really kind of lays out some of the underlying causes for what we're seeing. You know, uh, and you're right, being a teenager was hard enough when we were going through it, never mind what kids today are kind of getting bombarded with. What are some of the ways that you're seeing um, these mental health symptoms kind of manifest themselves in in students? Like, what kind of symptoms or conditions or situations do you see them going through the most when you're talking with them?
Yeah, I mean, in terms of the mental health symptoms or experiences, like none of that is new, right? The social anxiety, the low affect depression symptoms, the hyper defiant symptoms, like those are nothing is new when it comes to the mental health symptoms that teens are experiencing. Everything that is new is what is causing those.
Hmm.
And so I think to maybe take the idea a step further, like when we think about treating those, right, we can think about, treating social anxiety in the same way that we think about treating it in adult, but it's different because the cause is different, right? And it's sort of like, if you find out that the cause of your high blood pressure is actually because you're really stressed at work and not because your diet is poor, the solution is different, even though you're
Hmm.
treating the same symptom. And so, though the symptoms are the same, I think the causes are different, which I think, a logical next question is like, well, what are how do you solve those things? So, yeah.
Yeah. So, in your experience, when you were kind of working on developing new ideas to reach teens, what did you find that was kind of working? And then on the flip side, what did you find, especially in like our traditional models of trying to provide mental health services, was absolutely not functional anymore, either anymore or it just never was and we didn't know?
Yeah, it's a great question. And before I even say that, like the good news is there's hope, right?
Hmm.
Like kids are seeking help. They are self-aware that they need help. Kids know that they are struggling. It's not as if this is like what is happening to me? Like they know they're seeking help and they want to feel better. Every team we talk to, just like every person who ever interfaces with NAMI, you come to seek help because you want help. The thing that we learned very early on, which was I think a little bit alarming and made us really feel like this is a problem that we have to solve, is we learned that the way that kids seek out help is very different from the way that parents seek out help. And so even though they are seeking, the path towards getting them into care is very different. And because of the way that they seek care, they were often not finding care that felt appropriate for them and then opting out and disengaging from
Mm-hmm.
their care totally. So let me talk about how adults seek care first, from what I understand. So, adult who has an issue, let's say it's a anxiety issue, right? There's an assumption that anxiety issues or mental health issues should be treated by professionals. And so the question for a lot of adults is who's the right professional, right? Is it a psychiatrist? Is it a clinical psychologist? Is it a therapist? And you're sort of going directly to the clinical care that you may not know which is appropriate for you, but the idea is which professional is going to help treat me, right? Um, that is not how teens seek care. And I'll talk about the reasons why, but how teens seek care today is often first through self-serve content and media means.
Hmm.
So when a teen is dealing with an experience, and we see this firsthand, they will go and try to figure out what they are experiencing by reading Reddit threads, by looking on the internet, by looking for content on TikTok, right? What they're looking for is what I'm experiencing like real, or am I just making this up? And they're the because the information is requires no energy, no effort, they don't have to talk to anyone, that's where they go first. And so in the moment, they are sort of seeking help by just trying to educate themselves on what is happening. So that's stage one. Like they're going to go out and kind of do their own thing. Stage two is they're going to then engage with lower forms of care where they feel like their experience can be validated and authentically resonated with. These are things like online communities. These are things like, um, in our case, peer support, right? They're looking for ways to feel a connection around what they're going through. They're not necessarily looking to just treat the issue as a medical condition. And that's, I think, only then, only after they have found an authentic resonance with other people who have dealt with something similar, will they have the trust to go and seek out clinical care from something that somebody else who has gone through something similar has said help them, right?
Mm.
There is a fundamental requirement for trust that what they are going to try is going to help them that I think is different in the adult population. And so, what this means is if you're actually going to try to go upstream and reach kids who are needing help before something happens, you really have to meet them in this stepped model of we've found a way to help them help themselves by understanding what is going on. We've then given them a lower stakes, lighter weight way to build trust that they are on the right path towards feeling better. And only then, for the kids who it's appropriate, can we go and actually deliver clinical interventions to help them improve. And I think, though this is not how our mental health care system works today, this is probably the right way that it should be built. You know, when we think about stepped care models, the idea is you only bring people into the clinical care who actually need it, and you do a appropriate triaging prior to that. And so I think the way that Teen Seek Care is actually much more aligned with that. Um, but what was very discouraging for us when we set out was there were not high quality self-serve content options or lower forms of care available for kids. You know, ending up on a random Reddit thread talking about the thing they're going through is likely not the best place for them to find actually helpful information about how to feel better, right? Like it's just not. Um, Online communities, same thing. Like there's lots of people who you can resonate with the experience, but there's not a clinical rigor to it. There's not vetting. And
Mhm.
so I think we sort of set out to figure out like how could we actually build that stepped care process in a way that did have clinical rigor and like we felt confident that was not just like random people talking about their one-off experience, but had some sort of validity to it in a clinical sense. So yeah.
Yeah, and in fact, as you were saying that, I was thinking about, the rise of mental health awareness, especially online and especially in platforms that younger people use, has now kind of swung the other direction and has led to, a rise of misused quote unquote therapy speak or self-diagnosis or, you know, a misunderstanding of mental health conditions and what they might, mean for people's lives. And I'm wondering, is is that rise of awareness been helpful or more harmful or a little bit of both?
This is me totally opining here, so take that with a grain of salt. I think it's net good, right? I think
Mm.
if you ask a group of kids how many have ADHD, probably 8 out of 10 will raise their hand, even though I don't know how many of those have actually been given like a real appropriate clinical diagnosis. Um, and so I think in that way, like self-diagnosing, we see a lot of kids do it. finding maybe inappropriate diagnoses or things like it happens. But I think on the whole, it's actually not as harmful as kids going without having or being so um, outside of the system that they can't get any help who actually
Hmm.
need it, right? The kid who thinks they have ADHD and tells their friends they have ADHD when they probably don't, like that kid is not necessarily at risk for anything. But the kid who feels like mental health is not allowed to be talked about and so is dealing with severe depression, but they can't tell anyone about, like that's the kid who is at real risk. And so I think
Hmm.
like the overswing towards being open about mental health is probably a net positive, even though it would probably make sense to pull it back a little bit and be a
Right.
little bit more safe about it. But yeah, I would say like my opinion would be that I think it's probably net good.
So my next question was, what do you think we need to focus on specifically in developing services for teens? And you've already started talking about kind of starting with a peer support model. Can you elaborate a little bit more on kind of what your team went through when you were figuring out how you actually wanted to combat this problem?
Yeah, and I think I'll try to answer this from first like the general lessons that I think anyone can take away, and then I can talk specifically about sort of like what we have done and how we've tackled the problem. But there's many approaches to this, and I'm not at all claiming that ours is the only one. Um, I'll start by sharing a story. I was speaking with a school teacher the other day who teaches sixth grade English, and about half of her students are special needs. And I asked her, I was like, what? Well, I first asked her, I was like, how many of these kids are struggling with their mental health? She's like, a lot. And I was like, okay, that makes sense. What do they need? Like, how do you connect with them? Like, what is the thing that you feel like takes a kid who maybe is struggling but not open, and how do you change them? And her answer kind of surprised me. I was thinking there would be a very clinical or strategic or some like strategy, but she essentially just said, like, look, just show them genuine interest, authenticity, and a constant validation for their life and experience. I was like, wow, that's beautiful. First off, like, and what she shared with me is how few of these kids actually have that from their
Hmm.
families, from their friends. Very few kids have people who just actually listen to them and actually say, I what I hear you say, like I believe you, and I
Hmm.
believe that what you're going through is valid. Um, and even when we think about the mental health or just healthcare system that we have today, like how often does that happen? Put yourself in your mind of the last time you went to a doctor's office. Like, what was that doctor doing? They were probably typing on their computer in their Epic system. They probably weren't looking you in the eyes and saying, interesting. Like, tell me more about that. And so I think if you want to reach kids, um, you really have to build a human connection with them. And you really
Hmm.
have to help them believe that you are there to help them with your actions rather than just, saying you are or coming through. I think another thing that's really important, especially for a lot of kids, specifically on Medicaid or youth and foster care, a lot of the adults in their life are very transient. They are
Yeah.
they come in, they come out. Even parents oftentimes are not as stable as I think we would all hope. Um, and what a lot of kids really crave, and to get to that trust of, hey, I believe that you're here to help me, sometimes you just have to keep showing up over and over and over again. And and another piece of authenticity that I think is just really interesting when you compare it to our mental health care system, like um, a session-based model feels really transactional to kids. Like they know that you're only here for an hour to talk to them, and as soon as that hour goes up, you're out the door, right?
Hmm.
And there's something about that like prevents kids from really being able to feel like, oh, this person's here for me. Like my relationship with my therapist, I know that even though I pay her to be there for an hour, like I know that she genuinely cares about me and like actually wants to help me and is there for as long as I, want to continue. I don't think kids have the cognitive awareness to be able to intellectualize that when what they feel is after this hour, this person is going to go into their life and they don't care about me at all.
Hmm.
So those are, I think, a few things. One other thing, actually, that I think is relevant given the difference in the world that kids live in today, because I think those other things like genuine, authentic desire and care, consistency, like those kids over the history of time have needed those things. One thing that is different today is I think kids demand um, more immediacy, more on demand, and more uh, ability to dictate the experience today than people in the past. I think that's because they live in a world where all of the services and products that are built for them are really built well. You know, like you can get food delivered instantly, you can get a car go somewhere instantly, you can get any information instantly. And the idea of like I have to wait a month to talk to someone when I'm struggling right now, like it doesn't compute, and you've missed the opportunity to catch them in the moment. Um, and so like and I actually think this is a problem with all of healthcare. Like I think adults should be frustrated with this as well. You know, like we just don't have a system that is built with a real user-centered approach to it. And a lot of that has to do with legacy healthcare reimbursement. I could rant about that on a podcast sometime else, but I'm not going to do that. Um, so I think in addition to just building the real, genuine, authentic connection, um, having a better service experience and being able to have teens tell when they need it and whatnot, I think is really important to them. So those are kind of the general themes of like how to reach teens a little bit better today, and how to position yourself to do so. I can sort of talk a little bit about some things now, which is how we've taken those insights and built an experience around it that we are bringing to youth across North Carolina through our partnership with the Department of Health and Human Services and the Department of Mental Health. Um, and maybe before I do, just to kind of contextualize the youth that we serve who come and seek out some things because you know, we are a peer support driven intervention. That's why we're here at NAMI. It's why we love NAMI. You guys are people. But I think when a lot of people think about peer support, they sort of think about low acuity, you know, people who are not necessarily struggling, or they think about substance use.
Mm.
Um, about 53% of the kids who seek out care from some things today in North Carolina score a moderate to severe on the PHQ-8 at an intake. So these are kids who are coming in with potentially really serious and complex issues. Many of them have self-harm. Many of them have had suicidal ideation or attempts. You know, these are not kids who are just like struggling with school stress. Now, um, the thing that we realized on the flip side, though, is a lot of the kids who seek us out are also not dealing with SMI, right? Like they're not dealing with complex schizophrenia, or they're not dealing with like treatment resistant depression, right? These are a lot of kids who are really struggling, but they're just sort of like the stressors that I talked about earlier and the skills that they have to match them are insufficient to meet. And so you
Mhm.
get kids who are really struggling, but but again, like these are not kids who you would look at and be like, wow, that's someone with like a really severe mental illness. So that's, I think, just kind of an interesting contextualization of who are the kids seeking us out. What we set out to do with some things was to create a really low barrier to entry way for kids who are doing that sort of self-seeking to get to talk to a certified peer specialist who comes from the community that they serve, who has been through their experience, to be like a first touch point and a front door into care. And to use that certified peer specialist as somebody who can help stabilize a kid if they need stabilization, who can help navigate them to other care resources if they need, or who can just be a consistent person to show up over the course of the first months of their journey in their treatment to help them feel like there is someone who genuinely, authentically cares about them.
Mhm.
And um, what we realized was the way to give kids the product experience that they wanted with the peer was not to allow them to do sessions, was not to ask them to do anything, was instead to connect them to that peer certified peer specialist mentor on a mobile app and have that peer mentor be online and available after school hours throughout the week as whenever kids want. So what we do is we staff our mentors from about 4 or 5 p.m. to about 10 p.m. Monday through Friday. During that time, we're paying them to just sit there and like have conversations with any of the kids who show up. And they have about 20 to 30 kids, depending on the mentor. And any of those kids during that time can just pull up their phone and text their mentor and get an immediate response and have like an
Mm.
immediate conversation. And the idea was for kids, you say, okay, this person is going to be here for you every day of the week if you want. Your only job is when you want to text them and let them know that you want to have a conversation, and they'll be there to respond. Um, and so what we could do with that was give them the consistent relationship that they were looking for with somebody who understands their world and can build the authentic relationship, but then to do so with the immediacy that they were asking for in a way that like we could sustain as an organization and actually ask people to do, right?
Hmm.
What kids actually wanted was 24/7 with the same person all the time, immediate responses, which like you could just, it's hard, it'd be very hard. If someone can build that product, I would be super thrilled. And and when we started doing that, we just saw engagement go through the roof. Like we saw kids, the first month we started doing this years ago, we saw kids text their mentor every single day that the mentor was online. Crazy messaging, crazy engagement. Kids would start requesting video calls after they got to do some texting with teens or with their mentor, which previously we hadn't seen teens request video calls. So um, just being able to provide that engagement was really interesting. The other thing that we really found worked was every day our mentors will send a message to their kids, just letting them know that they're around and that they care and that they're here and available. And like every sort of 5-star review we get has the quote of like, I love the messages that I get from my mentor daily, which like
Hmm.
is such a small thing. And like it's not even like a product innovation. We just like have the people, our mentors care about these kids and like genuinely want to show up for them. So um that's kind of fundamentally how it works. And with we had launched the partnership. We'd launched a partnership with Alliance Health to serve some of their youth on Medicaid, and I think the NCDHHS sort of saw the need across the state well beyond just Medicaid and also well beyond just the population that Alliance serves. And so when they enlisted us to support youth across the state, this sort of idea of having the very low stakes, much more engaging, very easy to access resource for kids to get on the way in just felt like for them, I think that it was one of the many solutions to help keep kids out of the ER, to help keep them from spiking up and having suicide attempts. It's actually really unfortunate. Suicide in 2019 was the leading cause of death in North Carolina for youth
Hmm.
aged 10 to 14, which like this is a very sad stat. And so um, we're super thrilled. And maybe Amy, I'll pause there, and if you want to talk more about the product, I can talk more about that. We can talk more about North Carolina, whatever would be helpful.
Well, question, do your mentors ever have to kind of help guide kids further down kind of the treatment line? Like, they come across somebody who's really in distress and they need to immediately patch in, crisis intervention or anybody. I'm sure you guys run across those situations all the time.
Yeah, absolutely. And one other thing I'll mention is, and many of you know if you're familiar with peer support, clinical supervision is a requirement in many states for peer support, and I think also just the right thing to do. And so, all of our mentors are actively supervised by licensed clinicians in who are there to help them direct the mentorships and make sure that the mentors are being actually effective in their conversations, but also to help them triage escalations, make sure that teens are we're stabilizing teens who we can stabilize or who we're getting them to crisis resources if they need. In addition, our clinical supervision team does a lot of the care navigation and management for youth who maybe aren't in need of an immediate crisis where there's risk to themselves, but might be presenting with something that really does need clinical support. And they're the ones who are helping connect that teen with the right community resources when they're available. Obviously, we all know the problem that, especially in North Carolina, there are some communities where things are not available. And
Hmm.
so we do our best to navigate that as possible. Um, yeah.
Yeah. So tell us a little bit more about the product and like what the user experience would look like if you're a teenager who's just downloaded this thing, doesn't really understand how it works, and is just figuring it out.
Great question. And I think we've put like so much thought into the first experience from kids because what we've heard from youth is like when I am reaching out for care, I'm really nervous. I don't know what to
Hmm.
expect. I don't know if it's going to help me, and I don't have trust that it's going to be able to help me. And so we've like really tried it. We've invested a lot of time and energy from our team just trying to figure out what are the first moments that a teen needs to have with their mentor in order to be successful. And so what it actually looks like, and again, the goal was to reduce barriers to care and just
Hmm.
to have something, a touch point that kids can go to when they need So a teen would find us either through our website or through the App Store. They can download our mobile app, which is HIPAA compliant and where all of the conversations happen. They'll fill out a quick form about what they're looking for out of their mentor, and then they'll get matched with a few mentors. They get to select the mentor who they want, and then as soon as their mentor is online, which again happens like 5 to 10 p.m. Monday through Friday, as soon as that happens, they're ready to go. And so we've actually seen that on average, the time from a teen completing their onboarding survey and talking with a mentor is about 10 hours for all teens. And about 50% of teens end up waiting less than an hour to talk to their mentor because they sign up in the same day and their mentor is ready and available.
Hmm.
So that's like really cool. We're very proud of that actually. And we're obviously trying to always increase that number. But the real idea is as quickly as possible, get to that first conversation with a mentor. And then from there, I think what we know from peer support and what we know from what people want is like it's not just a hey, tell me what's going on, let's solve your problem. It's like a hey, let's get to know each other. I want you to learn more about my own journey. I want to open up. And so we have the mentors do a lot of the relationship building through sharing their story and through building trust with the teens before we jump into like some of the other things that teens might be going through. And for many teens or some teens, they want to come in, they want to talk about the one thing that's going on that day. And like that's great. The mentors are there to do that. But this isn't just like this is not a crisis resource in the sense that like teen comes in, we solve problem to teen leaves, we don't see them until crisis happens again. This
Hmm.
is like we are trying to stabilize the teen by building a relationship with someone who can be there to support them over the course of a few weeks, a few months, etc.
Yeah. No, all of that is great and really takes out kind of the need for a middleman because sometimes one of the barriers to care can be, well, I have to go through my parents and I don't necessarily want to bring this up to them, but they're the only way I can get care. This is a great way to kind of eliminate that necessity. Which leads me to a question about, parents and caregivers. With the kind of this crisis, you and other organizations are looking into ways that you can just reach out to the teens directly. But what would you, if you had a moment to sitting down with all of the parents of the teens that you've encountered, what would you most want them to know about what their kids are going through and how they can be part of the solution?
That's a really good question. And I think really deeply about this because if you look at any clinical research, um, clinical models that involve parents and caregivers are more effective. In addition, like I have a strong belief that parents are a crucial and important part of every teen's health, both physical and mental health, if not the most important thing. Um, on the other hand, I have seen firsthand how how much of a barrier having parents involved is for teens to move up this continuum.
Hmm.
To give you an example of this, um, we had in the first year after starting our organization and providing peer support in the way that we do, we had about 10,000 teens apply to our program and try to get started. And at the time, at the end of our onboarding form, there was a question of, are you ready to involve your parents? And it was actually the first year that we did it, it was blocking. So if you were not ready to talk to your parents, you could not move forward with the program. We had about 5 kids over that period actually be willing to talk to their parents about their mental health.
Mhm.
5 out of 10,000. So, and when we talk to these kids, it is abundantly clear that um, the parent involvement is the single biggest blocker to getting care of any kind as possible. Now, the frustrating thing though is when we actually dove deeper and tried to learn more about like the fear that kids had. For most kids, the fear that they had of telling their parents about their mental health was I don't want to say unfounded, but it was not grounded in reality and facts about how that was going to go. Right? There was a small percentage of kids who said something along the lines of, which is very unfortunate, but said like, if I tell my parent about this, they will get mad at me, and I know this because it's happened before. Right?
Oh.
Like, there was a very small percentage of kids who said that, but the much larger percentage were afraid of they didn't know how the conversation was going to go. They were really afraid that if they reached out for help and got rejected, how that would feel. They weren't sure. A lot of them were afraid that they didn't want to burden their parents with what they were going through. So there was a lot of like fear about looping in the parents. And that fear was a absolute block to getting started. And when I talk to parents about this, um, I, I truly try to tell them like we spent a year of our entire team's energy and resources trying to solve this problem in a way where we could get kids to go to their parents, and we failed. Like we could not do it.
Mhm.
And from what I know about all the other services and products out there, like nobody has done it. And so um, where we've essentially landed is trying to reconcile those two things, which is um, parents are absolutely crucial to their teen's mental health journey, and oftentimes they are a blocker towards kids seeking the care they need. And so where we have sort of landed, and I think we've found really strong partners in the NCDHHS for this, which is we have to provide an outlet for teens who need help. Like
Mhm.
if we don't, they are going to scale in acuity. They're going to try to hurt themselves, or something bad will happen. And they're going to end up in the ER. They're going to end up in the hospital, or something even worse, like a suicide completion. So if we don't do anything up front, the problem is still going to happen. So we have to do something up front. Our perspective is for youth who come into our program who are not ready to talk to their parents. And we ask every teen who comes to our program, are you ready to loop in your parents about this? For the teens that are not, a core directive of the first few conversations and weeks with a mentor is working on that and trying to understand more
Mhm.
deeply about what are the issues that are coming up that are preventing that teen from reaching out to their parents for mental health care. Because the unfortunate reality is any other service that the teen is going to use, outpatient, um, prescription, et cetera, those all require parents either because they're going to get a billing on their insurance claim or something like it's the parents are going to get looped in. So our mentors really try to build the trust of being the, hey, I'm here for you regardless, but I need you to know that we have to loop your parents in eventually.
Mhm.
And we really try to use the trust that we build to get those kids warmed up to the idea. So it's a really hard conversation, and I wish that kids were much more willing to do it, but they're just not. And so, I always encourage any parent who has any concerns, like reach out to us. We are here for families, and we
Mhm.
want to find a way to support the whole family. Um, and we're really trying to balance sort of the need of this, the urgency of this problem with what we've seen is potentially or what is real out there with teens. So
Yeah. So if parents kind of learn that, you know, their teenagers are assuming that this is going to be a rough conversation, this is not going to lead to positive outcomes for them, what could they potentially kind of do with that information to be proactive with their relationships with their children, to kind of head off this fear at the pass? Is there any advice that you would give to parents?
I can give lots of advice. And nothing will work 100% of the time.
Hmm.
But the honest truth is, and I think this will resonate with everyone here because this is NAMI. Like, be open them first. Like parents, I think often feel, from what the conversations I've had, parents feel a responsibility to be strong and solid and um, model strength for their kids. But parents are not as often willing to model weakness or model openness about what they're going through. And if you want your kid to be able to be open to you about what they're going through, you have to be open to them. And so I think my blanket advice, if I could only give one piece, would be if you want to open up a conversation about your teen's mental health with them, first start by opening up a conversation with them about your mental health.
Hmm.
Give them something, give them an arrow in their quiver, so that way when they're ready to send it back to you, they can do it, and they know that because you've trusted them with something, they can trust you with something.
Yeah. Um, we'll take questions from everybody listening in just a second. And if you do have them, please feel free to put them in the Q&A. We've got time for questions. But I wanted to see if you had any kind of specific success stories from this project that you felt comfortable sharing? Anything that might stick out about, you know, teens who've really found positive outcomes through using some things?
I mean, so many. Like right off the bat, last week we had a kid tell their mentor that they haven't self-harmed in 3 months and they hadn't done that in years. So
Mm,
like that's a huge win.
yeah.
We've got kids who had real suicide attempts, and their mentor was able to help triage them and get them stabilized. Like I mean, real impacts on these kids. On average, to give some average statistics, the kids who are in our service in North Carolina, on average, rated about a 4.7 out of 5 stars when they're just like, "How do you enjoy the service?" And we've seen about 50% of kids report a reduction in symptoms of anxiety or depression in 2 weeks after starting their experience with their mentor. So directionally, a lot of kids are getting help, and the one-off stories of reducing the self-harm or helping the suicidal kid like are obviously really impactful. So yeah, that's what I can say.
Excellent. So we have a couple of questions from folks in the audience that we can go ahead and take. One is, what is the bottom line on cost for this platform? How do the people participating pay for it? Or is this, I think this person is kind of asking like, where is the funding coming from if the kids don't pay?
It's directly from DMH, so there's no cost to any youth in the state for the service.
Hmm.
Any teen, regardless of their insurance coverage, as long as they're a resident of North Carolina, they can access our service totally for free, which is amazing. And like, if any of you work with DMH or NCDHHS, like give them a shout out for everything they're doing, because they are like, honestly, and no shade on the other state friends that I have, but like they're miles ahead of other states when it comes to the work that they're doing on these sort of population health level interventions. So yeah, no cost to any teen across state.
Yeah, that's fantastic. Um, and so one person asked if there was a certain amount of time that youth have access to daily communication with their mentor. That's that kind of 4 to 10 block. Do you guys, you offer your hours on the weekends as well, I'm assuming?
Yeah, there's the mentors are online a little bit on Sundays. What we
Hmm.
actually saw though was that 98% of the interactions that kids had when it wasn't capped to those hours was within those hours. And so what that allows us to do is have the mentors fully present, fully on board, fully having the conversations during those hours. And then when they're off, they're not available. But in our app, teens can access crisis 24/7 crisis resources and other resources available for them. So it's not that they can't ever reach anyone through us, but the mentors are only online during those hours. And
Hmm.
I saw a question pop up, which I'll just answer off the bat. So the age range is 13 to 19. So really in like the later middle school, high school, early college range.
Hmm. And then that question also asked kind of what happens when they age out. Do your mentors have kind of a coaching program for your older teens about like, okay, now you may need to graduate to other ways of getting services, but here's how to do that? Or do they have a different process?
There's no hard graduation actually. So if
Hmm.
a someone who starts as a 17-year-old, they stick with us for years, which would be amazing. If they then, turn 19, we're not just going to like kick them out of the program.
Right.
What we typically find though is that once we get into like the transition age post high school, a lot of kids are naturally sort of graduating out of the program themselves, but there's no hard cutoff.
Hmm. That's good. Let's see. Do you have any data on the demographics that you might serve most, especially when it breaks down into like subcultures? And have you noticed any kind of implications of any of the different cultural demographics, the way you have to communicate with people, anything like that?
Yeah, it's a good question. So what I can provide, actually, I have it. Let me pull it up right now so I can get the exact specifics. So we collect demographic information from youth that we serve. So we have about 41% white youth, 29% Black or African American youth, 16%. Oh, sorry, I was reading my mentors. They're next to each other. 41% white youth, 24% Black or African American youth, 15% Hispanic or Latino youth, 12% Asian youth, and then 8% other.
Hmm.
Um, so, uh, which essentially perfectly maps to our mentor population. We have 29% Black or African American mentors. We have 16% Hispanic or Latino mentors. And so, in terms of like the differences between the different cultural backgrounds, like what we try to do is just match them with a mentor who shares that similar background.
Hmm.
And so I don't know that I can comment on like the necessary differences, although like it's obvious that there would be, given that we're matching people within those different cultural and demographic backgrounds.
Yeah, that's great. Um, I think we have answered the question about the service being free. That's definitely an enormous plus. We're able to give this away thanks to state funding for these kind of services. Um, and then it looks like, could you reiterate how we can connect youth to the services if we know somebody who needs it?
Yeah, it's a great question. And I'll make sure, Amy, that you have everything you need to send out after this.
Hmm.
It's really easy, though. All you have to do is tell them to go to somethings.com and click the Get Started button. We try to make it super easy. And youth or parents or anyone, if you just go to that website and you click Get Started, there's a form that will kind of route you where you need to go. And teens can seek it out on their own. Parents can start the process. Anyone can start the process for someone else if you're willing to give their information, so that we can reach out to them. But we try to make it really easy, and that's the best way.
Yeah. And then can you tell us a little bit about how you find your peer support mentors and what process they may need to go through to get involved?
Great question. The core pillar of the peer support that we try to bring is by bringing people from the communities that we serve. So
Mhm.
we do a lot of recruiting from North Carolina, and we really try to go broad across East, Central, West, and recruit people from. Typically, it's colleges. Typically, it's the university settings where we can go to psych programs or graduate programs in mental health fields. And we've honestly been overwhelmed with people who are interested in being mentors. I think we have like a current wait list in all of our states of about 3,500 people who want to be peer supporters. And this was sort of like the amazing unlock was how many young people don't actually know, young people who've recovered from mental illness didn't know or don't know what a peer supporter is or that they can become one.
Mhm.
I didn't before I started this. And there's so many people who want to be um, want to help and want to be supportive. So yeah, we've been working really hard across North Carolina to recruit people, and then we go and get them trained and certified as peer specialists. So um, yeah,
So you guys are, when you look for mentors, you're deliberately looking for kind of people with lived experience themselves and that are kind of fit within a certain age range so that they can better relate to the teens. Do you have kind of those qualifications put in place?
yeah, absolutely. And they have to fit the qualifications for a peer specialist,
Hmm.
regardless, which is lived experience, ability to talk about their lived experience, reference letters, those all things. And then we're just looking for people who we think can really deeply relate to these kids and who have an ability to speak on what it's like to be a teen today beyond just what it's like to have a mental illness today. And because we're not just recruiting people who are certified today, because we're recruiting people and then getting them certified, we're able to find a lot more people who have a much deeper ability to connect with teens than, because unfortunately the population of peer specialists today is relatively small. There's like not a lot of them across the country, especially in a place like North Carolina.
Is there a special certification for the mentors to serve people under 18? Because in a lot of cases, certified peer support specialists may not be able to serve people under
Yeah, so
18.
North Carolina is working on a youth peer specialist certification. They don't have one currently, and so all of our mentors are just standard certified peer specialists.
Okay,
That is in process though at the state.
that's great. And then are the mentors paid positions or volunteers?
These are all paid positions. And part of I think our ethos too is we wanted to we want to demonstrate at large scale that peer support is a really effective intervention. There's lots of research that shows that it is, but nobody has really done it at scale. And we want to bring that as a professional mental health field by providing a path for people to earn an income doing so, by providing a path to help people upskill. One of the feedback that a lot of peer supporters have is like there's no upward mobility, right? Like you can't once you have a peer supporter, if you're billing for that peer support, like that's what you get. And so like we want to provide opportunities to upskill people who maybe want to become a clinician or become a therapist and help build pathways to help them fund college and things like that. Like we have a lot of
Hmm.
visions about how we're doing that. I would be lying if I said we're doing all of it today, but there's just so much opportunity, I think, to bring people into mental health care, to get them excited, to make them be really effective, and then help them move on and do amazing things.
Yeah. So what is, well, let me, oh, I think we have a question. Does this serve all of North Carolina? And you would say absolutely,
Any
right?
team who has a residential address in North Carolina can receive the service for free.
Hmm. And so, what is next for some things? I know you guys have been around for several years, but you're always looking to, keep working, keep innovating. What do you have coming down the pipeline?
I mean, to be honest with you, like we're really just trying to serve as many youth in North Carolina as possible. We're growing like crazy. I think we've doubled our teen population every month since we launched in late October, early November with DMH. So we're just really focused on just helping as many kids as possible, getting as many on board. But we are constantly trying to make our experience better in every regard. So that's obviously a big focus. But yeah, we're honestly again, we are thrilled to be partnered with such a forward-thinking state health department,
Hmm.
and we just want to deliver an amazing experience and help as many kids as possible.
Yeah. Well, it's a huge problem, and you guys have found a unique way to address it. So we appreciate you guys and the work you're doing. I'll mention too, just a shameless plug here that um, you know, if you have any further questions, you can check out somethings.com. Sorry, somethings.org.
Somethings.com. Yeah, something.
Somethings.com. Okay. I'm going to put that. I think I might have typed it wrong in the chat to start with, so I'm going to put that in there. Um, And then as far as NAMI services, as you guys are reaching out to the teens, we have support groups and family support classes for the parents of those who may be trying to learn more about their teens' mental health conditions. It is an on-demand class called Basics. So if you'd like to check out the NAMI North Carolina website, you can learn more about the Basics course, which can help family members learn about what their teens are going through and can kind of get, to where they're on the same page with their teenagers and are able to work together with them. Um, we will be sending out this recording and any other resources that Patrick's going to provide for us. But do you have anything you'd like to say as we're signing off this afternoon?
No, thank you all for the work that you're doing across the state. Be good to each other, treat people well, and yeah, have a good day.
Well, thank you guys so much for the work that you're doing, and we really appreciate having Patrick on. Um, we would we appreciate all of you guys being on as well. Thank you for the crowd that turned out and for the great questions. Keep an eye out for our next session. Our next session is going to be on April 23rd, where we're going to be talking with Amber Reed about how nutrition can affect mental health as well. We'd love to see you guys there. Otherwise, I hope you all have a great afternoon, and we will send you information next week. Thank you so much.